Well, good morning, everyone. Happy Wednesday. We are here this morning with the loveliest mother-in-law in the whole world. This is Marie. She's going to be our model this morning. Today we're going to be talking about neuromodulators. What is that, you may ask? That is Botox and Dysport. So these are the two products that we carry, and I thought I would just kind of review them because there's a lot of questions coming up, especially since we started carrying Dysport, which is not necessarily a new drug to the market. It's been in Europe for over 20 years, but it's definitely the competitive product to Botox in Canada. So we use both. One of the reasons we brought Dysport in, we've had it for about a year. We were getting lots of phone calls from clients who had been either in Europe or in the Middle East, and we're actually used to having Dysport treatments as opposed to Botox treatments. So we now have them both. But basically, both medications they're considered neuromodulators, which what that means is they affect the ability for the muscle to contract. So sometimes when I'm explaining it to a client, I'll say that what the drugs do is they block the junction between the nerve endings. So when the brain says contract the muscle actually can't respond. So the drug actually kind of binds to that receptor site, and it temporarily blocks the ability for the muscle to contract. So sometimes when people say, Botox freezes you or whatever, I'm like, or paralyzes you, I'm like, no, it just relaxes the ability for the muscle to contract. So typically we use neuromodulators for lines and wrinkles that are caused by muscle movement, and that's also known as dynamic wrinkles. So I'm just going to demo on Marie here kind of what those wrinkles, where they are. So definitely the most popular is in between the eyebrows. So Marie, give the camera a little frown. Oh, very good. All right. So there's a couple muscles in here, first of all, that pull this way. And then sometimes, try wrinkling up your nose for me, Marie. Okay, she doesn't really do that. But sometimes people, they pull this way when they scrunch. And so they get some line development going here, as opposed to, we call these the number 11s. Sometimes people have both. But either way, we usually do 5 injection points along here to relax that contraction there. When we do that, quite often, because this muscle pulls in and down, when you relax it, quite often you get a lift in the eyebrow, which most women really, really love that. Sometimes if we want to add to the brow lift, we'll actually relax the top part of the orbicularis oculi muscle over here. So let's go to the crow's feet, and I'm just going to turn Marie here a little bit. So squeeze tight like a big cheeky smile. Wonderful. So you can see here this crow's feet formation and relax. So this muscle, it runs all the way around the eye, and it kind of does this all the time. And as the years go by, that contraction starts to form these little lines. So sometimes we'll just put a little tiny bit of the neuromodulator around the eye, and what that does is it opens it up, which women love especially, okay? Do a lot for men as well. And now let's turn our attention to the forehead. So Marie has a very cute little forehead. She wears bangs, so I typically would not treat a forehead like that. Raise your eyebrows up for me, Marie. Up really high. Good, okay. So you can see this muscle formation and relax. Quite often, our clients want these lines treated, which we will treat them, but very conservatively. We do need to keep the injections high, because if we put the injections down here, we'll actually drop her eyebrows down. So some people get that confused. They think that by having injections up here, they're going to get a brow lift. It's actually the opposite. And again, how we get the brow lift is relaxing here and here. And then there's a couple little unique places that we can also use a neuromodulator on the lower face. So Marie, I'm going to get you to pucker for the camera. Wonderful, and relax. So this muscle that goes around the mouth, it's the same as this one. It does this all the time. Sometimes we'll pop a tiny little bit of a neuromodulator in that muscle, and it will relax the ability to pucker. Downside is you can't pronounce the letter P very good for about a week or two. I always tell my patients that 9 out of 10 women, they love it because it softens the lines. 1 out of 10 women hates it because they feel like they've lost a little bit of control of how they pronounce or eating with a spoon and things like that. So sometimes we'll try it, and it wears off pretty quick in that area. And then the other areas sometimes we'll do in treatments down through here. So Maria, I'm going to see if you can do that stretch there. Okay, so you can see these platysmal bands here, okay, and relax. So they're actually contributing to these necklace bands. And I know we have done this treatment on Marie in the past where we've actually put the neuromodulator in all of these bands, and it really does relax that. That's one neat thing we can do. We can also put some in through the jaw. So on me, I can do this really good, but when I pull this DIO muscle right here, it's actually pulling down. And as we get older, for some women, it really contributes to turning down the corner of the mouth. So sometimes we'll place some of the Botox or Dysport right along that jawline, and it kind of crisps the jaw. So we're going to do a quick little demo. You know, quite often out in the world of injections, there's still people, they're so scared of needles and all of that stuff. And quite often after they have a treatment, they usually respond with, that's it. So I'll show you, yes, question from the camera lady?
What is the difference between Botox and Juvederm?
Between Botox
Botox and Dysport.
Botox and Dysport. Okay, so good question. Basically, both of the drugs they're purified proteins. Each drug company, however, is extracting a slightly different protein to manufacture their drug, but they come from the same source. The other difference is Dysport, okay, it does kick in a bit quicker, and that's kind of part of their marketing campaign, is that it'll kick in 1 to 3 days, and we definitely do see that with our patients. I do have some clients that I use the 2 products interchangeably. Sometimes, you know, I'm finding a lot of patients are loving it around the crow's feet because it diffuses quite nicely. Same with, you know, if they've got a lot of forehead lines, they're quite liking it. Dysport, they have done side-by-side clinical trials with crow's feet in Europe, and they came out with a study that said that their product lasts 2 weeks longer. Some people care about that, some people don't. So, you know, again, on myself, I use them completely interchangeably now. The 2 drug companies, they're going to be going head to head, you know, as far as gaining market share, and they really want our patients, you know, obviously to use their products. So it's kind of a fun position for us to be in, because I think at any given time, you know, the drug companies are coming up with great campaigns to promote their product and, you know, entice, if you will, patients to try their products. So, you know, I tease my patients. I'm like, there's always going to be something going on, you know, to promote the product. So when you're in the clinic, just ask. But yeah, I definitely use them interchangeably. We charge the same for them. All right, so does that answer your question?
Yeah.
Yeah, okay. All right, so we use chlorhexidine to clean the skin. So I'm just going to clean Marie's skin, and I always tease patients and tell them whether they come in with makeup or not, we are going to clean them. So don't worry if you're coming straight from work with a little bit of makeup on. And we are going to do that lip injection, which I know Marie loves. And I got to tell you, of all the places that we can put Botox or Dysport, the upper lip is probably one of the more sensitive ones. So I generally do it first for my patients just to get it over and done with. So give me a little pucker again, Marie. Good, and relax. So the actual placement of the Botox or the Dysport in the lip is dependent on what we're trying to achieve. Sometimes if we're trying to roll that top lip up a little bit, we'll actually place the product right on the border of the lip. If, however, we're more concerned with these barcode lines, which most women get, okay, that's why we don't call them smoker lines anymore, we call them barcode lines. It's actually a loss of collagen. We'll place the Botox or the Dysport a little bit higher, okay, and actually this morning I am using Dysport. So I tend to pull the skin really tight, a little pinch, and we'll just tap in 1 unit there. And of course, with all injections, anytime we're putting a needle into the skin, there is a risk of bruising. So I generally prepare our clients and tell them, plan on having a bruise, and then if you don't, it's a great day. You know, sometimes you can have an injection and you can have it 10 times, and on the 11th time, you actually get a little bruise. So it's not necessarily the injector. You know, our face is a roadmap of blood vessels. So around the eye, you know, sometimes if we can pull the skin really tight, you know, we can see some of them. You can see this big blood vessel in here, that vein. I don't want to nick that, so I'll come around it. Sometimes, you know, when I'm training for these procedures with staff, you know, I tell them sometimes where you want to put it, you can't. You need to kind of back up a little bit so that we don't hopefully give them a bruise. We do our best. So you can see I nicked that little tiny blood vessel there. It shouldn't be too much of a problem, and I tease clients, just wear your glasses for a couple of days. And And I will just come to the other side here. And we'll clean her here. So again, we'll pull the skin really tight, little tiny poke, and you can see that Marie is quite comfortable. You definitely feel a little pinch, but it's not anywhere near what the TV shows portray these injections as, with big honking needles and stuff. We actually use the smallest needle available. We use a 31 gauge insulin syringe. Now I am going to do just a little bit of that muscle because Marie does downturn a little bit, and we've done this on her before and she likes it. So try and do that for me. Try and turn that muscle down. Basically I'm just feeling for that DAO muscle and turn. So I'm just going to pop a tiny bit in each side. We want to make sure we don't get it too close to this muscle here because it will actually affect the smile, which people don't want that done. And now we're going to do the middle, which again, this is the most common spot. So Marie, try and contract that muscle for me. Good, and relax. Sometimes patients, if they are scrunchers, will actually treat their little bunny lines in here. So these injections are a little bit deeper because this muscle is a bit bigger. The dosing is always based on the size of the muscle, and that's why it really ranges from patient to patient, you know. Some of our younger clients come in and they can get away with, you know, half the amount of somebody that's, you know, either got a stronger pull or been frowning longer, or men. Unfortunately, men have to have higher doses because their muscle is so much bigger. And just to give you a comparison of what we use for cosmetic purposes compared to what's being used for medical purposes, it's a fraction, okay? So total here, I think I put in Marie about 54 or 56 units, something like that, total. You know, medical purposes, they're using thousands of units, you know, down the backs of legs that are contractured after strokes or back spasms or anything like that. So what we use cosmetically is just tiny, tiny, minute doses. And, you know, even just to point out that the medical versions of Botox have actually been on the market for, you know, 30 years, close to 30 years now. So the drug is very, very well tested and has a very high rate of satisfaction. And in fact, I think it's about 97%, and I think Marie loves it too, right?
I do.
Yeah.
I do.
All right, so we did use Dysport today, so it'll kick in probably by the weekend. You'll just be all refreshed looking.
I will be.
And that's it. If you have any questions, please type them in the comments below or share the video. And have an awesome week. Thanks.